Hi guys, I can see some of you are there. Charmaine. Charms, are you there? Hi guys, I see you are there. Charms, Seth, and Charlotte. Are you guys ready to broadcast?
Yeah, I'm good to go.
Yeah? Charlotte, how about Seth and Charms?
Yeah.
Yeah? Should we go for it? Okay. 3, 2, 1. Hi everybody, and thank you for joining us. We are now live, so we will just wait for everyone to join this webinar for 1 or 2 minutes, and then we will start. We see that we already have 40 people watching us. We're really grateful. Thank you once again, and please hold on tight, grab a cup of tea, and yeah, we will be ready in 2 minutes. We will start in 1 minute, and meanwhile, please feel free to take a look at our itinerary or schedule for the day, just so you know what we will be covering.
Okay. And are we starting now?
Yeah, I think we can go for it, and anyone else that joins us will just catch up later with the recording. Thank you.
I can't share my video. Yeah, me neither. Is there a way for you to let me put my video on?
You should be all ready to go now.
Yeah. Okay. Do you want to share your screen then and then control the slides from there? All right. Okay. Welcome everyone to our third event for In2MedSchool. And today we'll be talking about the MMI Prep. So this is just a background about who we are. So we are more than 1,500 student mentors from all over the UK, where we offer one-to-one free mentoring sessions to disadvantaged Year 12 and Year 13 students who wish to study medicine. And we have a website called www.in2medschool.com, where we have uploaded a lot of resources for you, as well as our online webinars and education resources that can help you in your application process. And the next slide. So for today's itinerary, this is what we have planned out for you. We've got 4 brilliant speakers, including myself, and we are all medical students from various different medical schools across the UK. So each speaker will be talking a different topics that should be useful to you in your MMI prep for your actual interviews in the future. And those are the timings as well. And so now I will like to pass on to our first speaker for the day, Charlotte Bosake. She is a year 1 medical student, and she'll be talking to you about the style of interview and the types of stations.
Hi everybody, thanks for that introduction, Charmaine. So yeah, my name's Charlotte. I'm at the University of Manchester year 1, and I'm just going to walk you through basically what an MMI is and the types of stations you can sort of generically expect. So first of all, what even is an MMI? MMI stands for multiple mini interviews. So you'll be familiar with the usual panel interview format. There's one of you and 3 or more panelists in front of you, and you answer a series of questions. But MMIs, clues in the name, it's multiple mini interviews, and there's usually between 8 and 12 stations, and you move around each one, and each will be assessing a different type of characteristic of a doctor, and each interview will last no longer than 10 minutes, so they're never too intense, and it'll be approximately 2 hours total, and you'll be in a room with as many other medical students as there are stations. Next slide, please. So this is our most up-to-date list at the moment for which medical schools use MMI circuits. It's not as it would usually be other years. So if they're red with a line through, those are universities who have amended from using MMIs to a new approach, just because of the COVID-19 situation. And you've also got new additions like Imperial in there. UCL is still deciding for 2021, but we think they're leaning towards MMIs. And Plymouth have announced they will do MMIs, but they're going to look slightly different to how they usually do them. So if you're interested in any of these universities, this will be really helpful for you in preparing for interview. Next slide. So station type 1 is sort of your traditional expected station in a medical interview. It's just looking at your motivation to be a doctor, because the difference with any other degree is you can graduate from the degree and you can choose where you go, but medicine, they're looking, why do you want to be a doctor? Why do you want a career in their field? And an important question to ask to follow that on is, do you actually understand what you're getting yourselves into? You need to show a depth of knowledge about the career and the demands and pressures so that they understand that yes, you're a suitable candidate, but you're also a candidate who knows what they're talking about. And this isn't just based off some TV show you've seen. You've done the reading, you've got the experience, and you understand what you're about to enter into. But most importantly, like any other degree, that university wants to know why you're choosing them. They want you to sell them on why you should come to this specific medical school and not just any other medical school. What is it about their course that suits you, and why do you suit their institution? What are you going to bring that somebody else couldn't? Next slide, please. So station type 2 is prioritization. And this is basically testing your situational judgment. So I've referenced one of the entrance exams, which I'm sure a lot of you have done, which was the UCAT. And you should be familiar with the Guide to Good Medical Practice from the GMC. And the prioritization station is basically just making you apply the knowledge you should have from that document. So the drawing I've given you is what I got in my Nottingham interview a couple of years ago. So they gave me a card sort. It was a car crash scenario, and I had to sort through everything and basically say who I would help first. And they were just looking at what I would prioritize in that scenario and making sure that I was thinking practically like a medical student and that I could be calm under pressure. So it's good to just refresh your memory on some of those scenarios you might have encountered on your UCAT this year, because they can be a good indicator of what you might be asked. And there'll be a variety of ways people will do it. Some will verbalize it with you, and you'll have to kind of suss out, okay, they're assessing prioritization here, and just make sure you stay calm, really justify all of the steps you would take, and then you'll be just fine. Next slide, please. So station 3, medical ethics. The most important tip I can give you here is familiarize yourself with these 4 pillars of medical ethics. They'll be important to you for the rest of your medical career because they're basically what you should base all of your decisions around. So you can come back to these slides later. I won't explain it all to you now, but the basics of it are there. And a good place to go for follow-up is the Medic portal, where they really break things down individually. They give you example scenarios, and it's perfect. You can use it as a framework for any ethical question they throw at you. But there's a couple of common ones there that you can probably expect to be asked about year upon year because they're so topical. What you need to make sure you do is have an opinion. They don't want someone to recite the pillars to them. That's dull. And when you're going through hundreds of students for months on end, they want to see how you're unique, that you can express an opinion, really engage in conversation, but give balanced judgment like a doctor. Next slide, please. So type 4 is something we're going to cover for you later, and that's Nhs Hot Topics. So each year there's going to be something big going on in the medical field. That's the beauty of this degree, is there's always things to be updated on, and they want to see that you're already engaging with that community. So they're going to ask you things that are going to be appearing in the news. So something that's been going on for a while is things like junior doctor contracts. But this year you've got things like Brexit going on. And of course you've got COVID-19. So it's just familiarizing yourself with what's going on and just showing you're thinking like a doctor. And once again, forming an opinion, because you're not just any student. You need to show yourself as the person that they want to give an offer at their medical school. Next slide, please. Data interpretation. I know for a few people, those 2 words can seem a little daunting, especially if, I don't know, you've been on a gap year, you didn't study maths because you don't have to, but it's really nothing too intense. To study medicine, you've got to do biology, you've got to do chemistry, and it's basically that kind of level of mathematics you can expect. Very much applied maths, problem solving, and no harder than your entrance exams. It should be nice and familiar to you. It's never usually more than the GCSE standard, but it's good to sort of just refresh your memory. Best advice would be to go and do that numerical reasoning section in the UCAT. That's the kind of level you'll expect. But different institutions will have different methods, but they'll always let you verbalize it or at least write it down. Next slide, please. Personal attributes. So I've called this the Marmite moment because it sort of depends what you're like as a person, whether you love or hate this station. A lot of people love these moments in medical interviews because you've been working so hard for so long to get to this point, and to finally be able to tell someone all of the hard work you've been putting in is a real relief in a sense, because it's like, finally I can show you everything I've done for this. But other people get quite nervous, quite shy, because you don't want to come across as arrogant, but that's something we're going to help you with. We're going to walk you through it later on basically how to sell yourself without compromising your personality, in a sense, if that makes any sense. But the thing is with each station is it's only one station. You could have a total of 12 and you get a score for each one, and they look at those and then they decide if they want to give you an offer. You fall short on one, you could have 11 to pick it back up on. It's not the end of the world. Just literally come out of that station, put it in a box, move on to the next one and keep focused, and then you'll be fine. Next slide, please. So type 7 is role plays, and usually if you have 12 stations, you'll have quite a few of these because they're a really good way to see how you apply your knowledge of the medical profession. So it might be more difficult this year because obviously with COVID, you won't have had the chance to have as much work experience over summer. Maybe some of you lost volunteer placements. So my best advice now is just treat them like you would a normal person. If you were speaking to a patient, someone you didn't really know, you'd know what lines not to cross, but you'd also have just that basic empathy of looking after another person. And you're going to have a logical brain to have got to this point in medicine. We know you've got a logical brain and you know how to approach these scenarios. So it's literally just tap into that basic empathy, think how you can keep a professional line with someone, and treat yourself as if you're about to be a consulting doctor. And then it becomes much more simplistic. Go with your instincts. If you were on a hospital ward and you were speaking to a vulnerable person, how would you treat them? And then these scenarios aren't daunting at all. Next slide, please. So now I'm going to pass on to Chiara, our next speaker. And if you have any questions about any of the stations, just send an email to the In2MedSchool account and I can help you out with any questions you have. Hope that was helpful, guys, and good luck.
Hi, everybody, and thank you, Charlotte, for the lovely introduction and for talking us through the most common scenarios that we can find in an MMI. I am Chiara, as Charlotte said. I am a third-year medical student at Anglia Ruskin University, and I also am one of the events coordinators that organizes all of these events together with Charmaine. Today, I will be talking to you about work experience and background knowledge and what you should reflect upon and learn before approaching an MMI station. So work experience. We know that many schools ask for work experience as a requirement of your application. Year 13 students might have talked about this in their personal statement, and year 12 students are getting ready to do their work experience days. However, we know that unfortunately, due to COVID-19, these experiences are getting harder and harder to find. The possibilities are very thin. But I suggest that you watch this space, the In2MedSchool social media, as well as other pages on YouTube, on Instagram, etc., for some cool events that can give you some very good ideas of virtual work experience and more. But please don't panic because everyone is in the same boat. So for what concerns your work experience, when they ask about it in an MMI, they want you to reflect on it rather than making a list of the things you saw or the doctors that you followed. Therefore, I think if you're approaching work experience now, it would be good to start reflecting on what you observe or what you learn as you go along. But if you've already done it, just think back onto it and ask yourself some questions like, how did this work experience change my perception of the hospital settings? Was I able to see different aspects of care? What are the things that really left a mark on me and that I'm still carrying with me nowadays? You can prepare similar questions for your interviews by reading the notes you've made during work experience and maybe making a list of some bullet points that you'd like to mention in the station that you know is coming about work experience. I say this because often MMIs might be quite overwhelming and the pace is quite fast. So if you already make a list now of the things you'd like to say, the most salient points, there might be 2 or 3 very good points that you want to make, and just remember to say those things when reflecting on your work experience. So let's talk about some common mistakes that people make. We're humans and we all make mistakes, but as I'm telling you what mistakes people make now, hopefully you won't be making them when you approach your MMIs. So as I already said, often people make a list of the departments that they visited instead of giving examples of the amazing things they saw and what they would like to pick up during medical schools when they train as physicians. Another mistake that people can make is coming off as close-minded. So saying things like, I only like respiratory medicine, therefore I only went to the pneumology wards and I didn't want to follow any other physician because I'm not interested in that. Or saying something like, I was only interested in following the doctor because I don't think the nurses or healthcare assistants have an important role. I think that, first of all, that can be disrespectful towards people that are very, very important and needed in the NHS. And at the same time, I'm sorry to say, it's most likely false that you're going to stick to the specialty that you think of doing when you apply to medical school. This is because you're going to observe so many things that you might change your mind. And you should be able to pick up and observe a new skill from every specialty. So I think a good idea would be to demonstrate your budding interest in medicine, for medicine in general. However, nobody can stop you from saying something like, when I went to theater, I observed the amazing teamwork that was going on there and how skilled the surgeons and all of the team in general was. Therefore, I would love to work in such an environment. Because in that way, you might be showing that you've picked up some important qualities of a good doctor, as well as reflected on what you've observed. So what can you reflect upon? What are the things that you could have picked up during work experience? You could have picked up the qualities of a good doctor, like commitment, curiosity, teamwork, leadership, ethical integrity, knowledge, professionalism, altruism, and good communication skills, and more. You could have reflected upon how the NHS works, for example, how resources are allocated, how important it is to manage your time well, or how unfortunately some places suffer from lack of staff. However, as I said before, don't list what you've picked up, rather explore a scenario or a story and delve deep into something that you still bring with you nowadays after your work experience. So how can you make up a good quality answer? As I said, you can reflect, and here I listed 2 reflection methods. However, you can make up your own. I listed the STAR method. This is something that I used in my interviews myself. Situation, task, action, result, and reflection. And this method can be used in many stations. For example, if they ask you about a time that you showed the leadership, or a time that you had to use teamwork to overcome a very difficult task. It's a reflecting method that you can use in multiple stations. You can also use the reflective cycle method, where you go through description, feelings, evaluation, conclusions, and future actions. Both these methods are helpful to show what you've actually learned and what you're going to bring with you from your work experience. I think it's also very nice to mention how important every healthcare professional was, and not to focus on doctors alone. As I said, the NHS wouldn't work only with doctors, so show that you understand this point. And also be empathetic. I think sometimes it happens that you're a bit nervous and you might say things like, oh, that patient was a nightmare, or they were being completely unreasonable, but unfortunately that might show a quality that interviewers won't really appreciate. So remember to be empathetic towards every person involved in difficult situations, particularly patients under stress. So what are some possible questions that might ask you during your work experience? A very basic one, like what you've done and what you've learned from it, or if you have observed any difficult situation during your work experience, and what you think that the healthcare professionals in that difficult experience did well and what they could have done better. I think everyone makes mistakes, so it's good to be able to reflect on things that went well, but also suggest some improvements while staying polite, of course. What are some of the most important qualities that you have noticed in allied healthcare professionals? And if you were able to observe any of these during work experience. I know that some of you might not be familiar with allied healthcare professionals, such as art therapists, music therapists, and more. Therefore, I linked here on the screen this NHS page that kind of gives a description of everything that different allied healthcare professionals do. Some people might also ask you what you enjoyed about your work experience and what you found challenging. And I think this is a very important question, and I understand that some of you might think that you really need to come off as excited as possible for your future medical career. However, I think it's also important to be introspective and to realize that some things are challenging, but it's okay for them to be challenging, because if they weren't, you wouldn't be, there wouldn't be any point in going to medical school. We would all become doctors without spending 5 or 6 years learning from other people. So don't be afraid to say that some things you found challenging and that you wish to spend more time talking about this or exploring these things in medical school for you to be ready once you become a doctor. Lastly, how did your work experience change your perception of the medical profession? We will now talk a little bit about background knowledge. And as Charlotte said, there is often a station about Nhs Hot Topics or just the functioning of the NHS. By no means, everything I've written on the slides is a comprehensive list of the background knowledge, and most of them are bullet points that I think you will be able to go and explore in your time. So don't worry, you will receive this recording as long as you fill our feedback form, and then you will be able to do some further reading for your own knowledge. So let's talk a little bit about the NHS. The NHS was set up in 1948 after the Second World War, and this was done in order to provide free universal health care. This replaced patients going to hospitals and paying out of pocket for medical care, because of course these would kind of highlight the differences in social status between patients that were able to afford the care and patients that unfortunately couldn't, because they didn't have the financial resources. So it is fundamental that the NHS is free and available to everyone. But how do they manage to make it free? And they take the money from the taxes that we pay, and they have a huge budget. The NHS is a huge institution in the country and is made up of 6 values and 7 core principles, which I've put in the slide ahead, and you will be able to explore this in your own time. It's also important to notice that the NHS works differently in England, Scotland, and Wales, and some NHS issues might apply to one country and not the others. Northern Ireland instead has its own system called health and social care, so please be mindful of this if you're doing interviews in Northern Ireland. As I said, the NHS has a huge budget, 140 billion in 2019 and 2020. I honestly cannot imagine that sum of money. But importantly, 95% of this is used for medications, daily running of services, paying healthcare professionals, and more. And only 5% of it is invested in order for the NHS to stay sustainable by doing things like building new hospitals or drafting things like 5-year plans and more. So as I said, these are the values and principles that the NHS is based upon. And as I said, the NHS works on a long-term plan. What is their long-term plan currently? It is to base care upon individuals' needs, to improve the quality of community healthcare services like GP practices and more, to make services more accessible, bringing people more closer together, as well as providing online GP consultations for people that can't access GP practices, and this has been very helpful during COVID-19. They also have a focus on cancer, particularly on early detection and prevention by promoting a healthier lifestyle. They also support patients to manage their long-term conditions on their own, but of course receiving the support of their physicians. As I said, they focus on preventing illness rather than treating, and they also address the issue of short staffing that we might have talked about before. How have they been doing this? For example, I think in the past 3 years, they might have opened 5 or 6 new medical schools. So they are trying to train more healthcare professionals. Now we can move on to medical ethics. Charlotte has already mentioned medical ethics, but we can delve a little bit deeper into the topic now. As I think most of you know, medical decisions are not always straightforward because it's often hard to come to a decision, and physicians are human, and as human we all have our personal opinions that sometimes might interfere with the decision that we have to take. So there's 4 pillars of ethics that can really help you make a decision, or at least reflect upon it, but they will not bring you to a wrong or right answer, because in most cases there is no wrong or right answer as long as it's somewhat justified. So the 4 principles are beneficence, non-maleficence, justice, and autonomy. And if for the first time you look at these words, particularly if you're a 3rd language speaker or a 2nd language speaker like myself, you might wonder what they mean. Therefore, I put here a little definition. For example, beneficence means do good, and non-maleficence means do no harm. So you need to always work for the best of the patient, and you shouldn't put them through any procedure that without any explanation or without any benefit might harm them in any way. Autonomy means that you need to inform patients of the options that they have available. However, you cannot make a decision for them. As long as they have capacity, meaning as long as they are able to make a decision for themselves, you can support them, but they need to make this decision independently. Lastly, justice means that you need to use resources carefully and rationally and distribute them equally, regardless of race, religion, gender, and more. Other important ethical principles that you might stumble upon when we're doing some reading about medical ethics might be the principles of deontology, utilitarianism, and consequentialism. There are huge discussions about these topics, and if you've done ethics, or if you've done religious studies, or like me, if you did theory of knowledge in the IB, you might have come across these topics. But I just put them here for ease of reference when you guys are revising before your interviews, which hopefully will be coming soon. So we have the concept of deontology. This is basically the concept that says that every decision is absolutely right or absolutely wrong. So in any situation, there is one right thing to do and one wrong thing to do. It kind of doesn't take into consideration the different, different cases in which some things might be right for one person but wrong for the other. Then there is utilitarianism. It's a big, big word, but in it, what do we find? We find the word util, so useful, meaning what action benefits, what action is most useful to the greatest number of people. We then have consequentialism, which basically says that any action that we perform will have a consequence on some people. Therefore, we have to go for the action that has the best consequences overall. This kinda looks like the sentence from the Italian philosopher Machiavelli. For whoever studies philosophy, he used to say that any ends justify the means. Therefore, if you have an end, if you have an aim in mind, the means that you take to get there don't really matter as long as your best consequences are achieved. Where can you apply these principles? You can apply them to the Charlie Gard case, and I'm sure most of you have heard of the case of this child who unfortunately had a disease that didn't allow him to survive. And the NHS made the decision that treatment had to be withdrawn from him because it would just prolong his suffering. We then have the concept of euthanasia, in which we need to reflect about capacity, which I've kind of told you about already. Capacity is the ability to be able to make the decisions for yourself. We then have abortion, where we can talk about the argument of sanctity of life, but also the argument that a woman's own body is her own, therefore nobody can make a decision for herself. And then we can apply these topics to organ donations, but there's so many more that you guys, I'm sure, can come up with. Another very important concept is the junior doctor contract. It's important to note that this only applies to NHS England. As Charlotte said, it started in 2015 with some nationwide strikes where 90% of doctors went on strike. And this was due to the fact that the government was extending the working hours, however, keeping these longer hours as normal working hours instead of classifying them as unfavorable hours. Therefore, doctors would work more time during unfavorable hours, being paid less than what they think they deserved. A compromise was only found in June 2019 between junior doctors and the government. However, as Charlotte said, in medicine, there's always something new to learn. So COVID-19, for example, might impact the future negotiations about junior doctor contracts as more and more is asked to doctors. So I think you should stay tuned to find out what happens in the future and if there are any updates about the contracts of doctors in the NHS. And I also put this little link here for more info where if you really, really want to, you can understand the different compromises that had to be taken and the different stakeholders that took part in these discussions, like the British Medical Association and more. I am now going to tell you a little bit about public health. I'm sure most of you know what public health is, but it's just for the people that don't know, it's the science and art of promoting and protecting health and well-being, as well as preventing ill health and prolonging life through the organized efforts of society. Public health seeks to target healthcare at the population level rather than the individual level. It's been a lot talked about during COVID-19, TV and more. However, did they only start there? And the answer is no. It's been a fundamental branch of medicine since the NHS started, with some key examples like vaccination programs, the cleaning of our water, family planning, the banning of smoking in public places. And as you can see, all of these promote healthy behaviors that we are trying to encourage the population to take on. Why is it important to talk about public health? Because health inequalities, unfortunately, still exist in the UK, despite the NHS being free and available to everyone. And because we are spending a lot of money treating a disease where we could prevent it rather than treat it. I think more than that is not only about the money that we spend, but also we could prevent somebody suffering by promoting a healthier lifestyle. Therefore, I think we should do it because, why would we make people suffer? I listed some public health issues that are worth looking up, like obesity, infectious diseases and vaccination, and screening problems and screening programs, like the cervical cancer, prostate cancer, cardiovascular diseases, and maybe more. I'm sure you all can name other public health issues, but I wrote a last-minute tip to read about the current developments of the COVID-19 vaccine, because they might as well ask you about that, as it's such a hot topic in the news currently. As Charlotte said, another very important 2020 topic is Brexit, and particularly how Brexit will have an effect on the NHS. I think a lot of it is still unknown, as Brexit hasn't fully happened yet. However, there are some predictions that say that Brexit might affect the shortage of staff, which will most likely increase as workers will decide to go to other European countries rather than the UK. But also more money for the NHS was promised as an upside of Brexit. So hopefully the UK will be seeing more of that money going on to the NHS budget. However, that's still unsure. Some other predictions say that many pensioners that have decided to go live abroad in the EU might come back, and they might cause a burden to the NHS because most of them are going to be elderly and in need of the NHS support as much as they can. The BMA has once again written a document explaining the possible effects of Brexit on the NHS. But something that is important to notice is that everything that is regulated now by EU law will have to be regulated once again by UK law. So things like working hours and FDA drug approvals and much more. Lastly, I'm going to touch upon chronic disease. Chronic disease is a disease that lasts for a long term, so it covers all long-term conditions, which are conditions for which there is no cure, and all we can do is really manage these conditions through either conservative methods, being healthier lifestyles and healthier diet, etc., or the use of drugs to make things better for the patient. However, they will never be cured of these conditions. Some long-term conditions that are worth knowing are diabetes mellitus, hypertension, or asthma. Asthma is what I have right now because I'm really short of breath. And as an asthmatic patient, I was diagnosed this when I was a child, and I carry it with me every day. All I can do is relieve it with a little reliever that kind of opens up my airways and makes me breathe better. Hypertension is high blood pressure, and diabetes mellitus is a condition made up of different types of conditions where basically the body either doesn't produce too much insulin or becomes insensitive to insulin. Therefore, there's a lot of free sugar circulating in your blood instead of them being absorbed in your cells. Of course, this is in very simplistic terms, almost non-medical terms, but it's not very important for you guys to know the pathophysiology of these diseases or the pharmacology behind them, because really all you need to know about them is why it's important to know about these conditions. Like, they pose a huge burden on the quality of life of patients, and also they take up a lot of the NHS funds. Some diseases you can't really do much for, you're born with, like asthma. However, some other diseases can be prevented, like hypertension. So even in this case, we need to reflect on the fact that prevention is always better than curing. Next up, we have Charmaine. She will tell you all about virtual interview tips, and hopefully it will be a lighter session compared to everything I've told you. I'm sorry for shutting your ears off, but I hope it was helpful. Please direct any questions you have for us in the Q&A. Thank you so much, guys.
Okay, thank you very much for that introduction, Anna, and thank you for the knowledge that you've given us. So now we'll be talking about virtual interview tips. So how would you be able to carry out an interview through the screen? As obviously with COVID-19, a lot of things have now changed, and most universities will be doing their interviews online. So next slide, please. So what I felt would be very important for you guys to get familiar with is the software programs, and this is the platform that you will be using for your interviews. So because not many medical universities have released what programs they will be using, but these were the ones that I was able to find out for you guys. So for Zoom, they have an app that you can download onto your desktop or your onto your desktop. And Brunel, Brighton and Sussex, Birmingham, Bristol, and Swansea will be using that platform. And then Microsoft Teams, there's an app for it, but they can also be used on the web. So St Andrews and Sunderland will be using that. And so far, only Dundee has said that they're using Blackboard Collaborate, and that most students will not be familiar with that, but the schools will give you a link that you can click on to use the website. And the next one. Okay, so factors to consider for a successful online interview. I think there's quite a few things that you should take into account. So whenever you're in a virtual webinar, like even right now, observe at how the speakers are presenting, because every single speaker has their own unique way of presenting and showing themselves through the screen. So I think the most important thing with the MMI interview is that you should watch out for time management. So for each station, there will be a they'll put up like a clock on this big wall just to show what the time is, so that they know when to move you on to the next station. However, no one will tell you exactly like, oh, you have 5 minutes left in this station. So you need, when you practice, you need to keep in mind, okay, this is roughly how long I need to spend in this station, how much more time do I have left before I move on to the next one. And then obviously the obvious things like facial expression, make sure you smile, keep eye contact with the interviewer so that you show that you're engaging with them. Speak slowly and clearly. That's one of the main things that I feel a lot of students have problem with, because when you're in an interview, you start to feel really nervous and you start to slur your words. Especially during a virtual interview, you want to make sure that you have a very clear conversation so they can hear you clearly. You want to dress appropriately, so you want to dress to impress them. Your body language, your posture is also very important. So you don't want to be sitting slouched like that, and you want to be sitting up straight like that. So it portrays who you are as a person, and it also gives off a better impression, a more professional impression that they're looking for a prospective medical student. And if any time during an interview, if you are unsure about a question, do not be afraid to ask the interviewer to rephrase the question, because the interviewers are just here to get more information about who you are as a person, find out more about your personality, why you want to join the course, what makes you unique and what makes you different from the other applicants. And they're actually here to help you. So don't be afraid to ask them if you didn't understand the question correctly. And next. So these are just a few pictures that I've put up. As you can see in this picture, the applicant is smiling, he's got good posture, he's dressed appropriately from the top only. However, his room is a bit messy, the setup is not very professional-like. And what I would suggest is when you do your MMI interviews, try and pretend that you're going to an actual interview. So get fully dressed from top to bottom. Make sure your whole setup and environment is all neat and you are ready to sit to carry out an MMI interview. And next, please. And again, in this picture, as you can see, this girl, she's smiling, she's using eye contact, her body language showing that she's engaging with the interviewer, and she's using some hand gestures just to show what she's trying to communicate. So these are a few problems that you may encounter during a virtual interview. I think the biggest one would be a poor internet connection, and that can then lead up to lag speech, and that could also take up some time during the actual interview. Wrong software programs is something that I think can definitely be avoided as long as you familiarize yourself with what the platform that you having a location and a good setup can be a bit difficult if you're doing it because you'll be doing it from home. So you want to try and find an environment where you're in a good space to feel like you're in a professional interview and not just in a very comfortable room. And you want to make sure that your background is all appropriate. You don't want to show them like any dirty clothes or any messy backgrounds. You want to convey a positive body language as well. And I know a lot of students will also have problems due to their nervousness, so they could have voice breaks. And I think the biggest tip on that is just try and stay calm. It's quite difficult with me saying it, but staying calm really helps you to just process through your thoughts and just, you know, try and do your best in each station in the interview. And next slide, please. So here are just some interview tips and advice that I use when I practice for my interview in Cardiff University. So definitely practice being interviewed online. Find some questions online, practice them with your friends or even family members, do your research, and even if you feel you're not confident enough, you can always take video recordings of yourself, look, and then reflect on them after that. So look at how you were using your hand gestures or your tone of voice. How are you sitting? Were you sitting in the right angle? Were you sitting too far from the screen? Were you showing enough facial expression, making enough eye contact with the interviewer? Were you talking too fast or too slow? So these are all just very small details that you want to watch out for. Big tip is definitely be yourself in an interview. You don't have to be this perfect candidate. They're looking for people who are genuine and trying to just express themselves as to who they are. I would suggest definitely not having any notes because that can act as a distraction. Have the right equipment, prepare an environment, dress professionally, practice answers to common questions. There's a few resources online that we can find the questions, like Medic Portal is a very good one, YouTube videos as well. And the main thing is think of this interview as a conversation. You want to engage an interviewer and make it more conversation-like, so they just want to find out more about who you are as a person. And the next slide. So here are just some resources that I found. So Blackstone Tutors is actually really good because what they've done is that they've set out a page for each university. So let's say if you're applying to Bristol University, they've got a page just about the MMI interviews at Bristol University and the type of questions that they can give you. Medic Portal is also very good in terms of giving advice and what type of problems and what type of questions you can encounter during the interview. 6MAT also offers quite a few MMI and panel interview resources. And I think YouTube is also always a go-to resource because there's so many different types of videos that's been released to help prospective medical students. And even these are just tips that you can use in a general interview. It doesn't have to just be in a medical interview as well. Okay, and now I will pass on to our last speaker, Setthasorn, who is a third-year medical student in Cardiff University.
All right, hello.
Yep, we can hear you.
Okay, all right, thank you very much. Okay, so hi everyone. Hi, my name is Setthasorn, but you can call me Seth. And I'm a third year medical student at Cardiff University. So today I'll be presenting on my personal experience and as well as to give you a bit of practice stations, just so you can have a feel about the kind of different questions that can come up in MMI interviews. And also I'll really appreciate it if you guys could sort of like make this interactive. Go ahead, feel free to type in your answers whenever a question comes up. All right, so if you could go on to the next slide, please. Okay, so just a bit about my personal experience. I'm going to come from two different perspectives. So as an interviewee and a peer interviewer. So as an interviewee, meaning where I was and where you guys are 3 years ago. So I was interviewed by Cardiff University, and that was the MMI interview. And I was also interviewed by Cambridge University, and that was the panel interview. And on the other side of the table, which would be to be a peer interviewer, I'm just going to say peer here because I would not consider myself as an official interviewer. So I have led a few medical school interview courses and programs for prospective medical students like yourselves, for both students in the UK and overseas as well. And my mentees have received offers from Cardiff, Manchester, and some of the other universities that I've listed there. Okay, the next slide, please. All right, so the first question would be to discuss the potential benefits and risks of utilizing social media platforms such as Facebook, Instagram, Twitter, and LinkedIn in one medical's career development. To what extent are these platforms important to a healthcare professional? So feel free to take a minute, have a think about this question and type in your answers, and then we can sort of like discuss around it. Okay, I'm just going to give you guys about another 30 seconds. So we've been seeing, so some people have said confidentiality, very accessible to everyone, can get info very quickly. You could accidentally release information on a patient, which would be breaching confidentiality. So I can see a lot of you guys are thinking about confidentiality in this case, yeah? Okay, so we've got, so yeah, you also put yourself at the risk of mixing a professional and personal life together, yeah? So it's good that you guys are thinking from two different perspectives. So what are so again, the question asks for the benefits and the risk. And I can see that you guys are thinking from both sides, which is good. So some of you guys are thinking about how it can be useful for teamwork. You can use it to share cases to gain experience. So yes, if you can see on Facebook, there are some groups where doctors and medical students, they just kind of like upload sort of like rare cases which they see on which they see, and they sort of like just discuss what that might be, because that's in a way that's a learning experience for everyone. Yeah. Okay, so yes, we've got quite a lot of responses here from all of you guys, and I would say all of it is, they're all valid points. So yeah, could potentially lead to stalking or to give a particular hospital a reputation. Yeah, okay, so that's a risk as well. So it's good. So it's good that you guys are thinking from both again from both sides, the benefits and the risks. And the reason why I've put this question here today is because sometimes these kind of questions can come up, and these questions are what I would normally classify as argumentative questions, meaning what the interviewer would expect you to do is to, okay, so you acknowledge the question is asking for the benefits and the risks. Bear in mind that sometimes not all questions would explicitly put benefits and risks. Sometimes they could just say, discuss the utility of social media platforms. And that sometimes can be a bit more tricky because it's an open question. And with these kind of open questions, sometimes people could approach it in a more biased manner. So some people, maybe they have had a bad experience with social media and they end up spending the 6-7 minutes in the MMI station just talking about the risks, or I would say the disadvantages of social media platforms, which is not how you want to approach these kind of questions. So whenever you are posed with an argumentative question, always try to approach it in an unbiased manner. Always say, okay, so first I'm going to address the benefits. So you go X, Y, Z, what are the benefits? And also talk about the risks. And so like a lot of the things that you guys have mentioned today, they are all, again, they're all valid points, and it's always good that you guys are also able to think. So for example, in terms of benefits, so yes, it can sometimes be a learning opportunity. So like I said, some people upload cases on Facebook, on Instagram. So that's really good. I think some people have talked about networking as well, which is very, very good too. Because for example, if you go on Twitter, if you were to see pages such as COVID Search or Star Search, a lot of these are very big organizations which run collaborative studies. And one of the ways that you can keep up with all of these studies, say when they're recruiting collaborators, or whether they are just opening up a session for you to ask them questions about the paper that they have published, all of these things will be at your fingertips if, say, for example, if you're someone who frequently uses Twitter. So that's an example. And in a way, that also allows you to network with people. So sometimes people follow one another on Twitter, they end up chatting, they end up coming up with projects, and that in itself can also spiral into something very big for you in your medical career. So yes, those are among the benefits that you can talk about in your interview. And in terms of risks, so some of you guys have mentioned about how you may put yourself in a position where you may mix your personal and professional life, and obviously as a doctor, that's not what you want to do, because that could be potentially dangerous. And I can see here some of the points you guys have mentioned. You guys have really put a lot of things here, which is great. It's good that you guys are thinking about these things. Oh yeah, and confidentiality. So just now when I mentioned, for example, when I mentioned about uploading cases, it's obviously very important for you as a medical student or as a doctor. If you were to share any of these cases, it's of course important for you to make sure that that you've got consent, to make sure that you actually have all the legal things and all the ethical things in place for you to actually share that information. So that's important in that case. And if you were to actually accidentally overlook that, and if you were to say share patient information data on social media, then that would be very dangerous to both your career and the patient as well. So well done, well done. You guys have done very, very well to answer both sides of the question. Okay, and if you could go on to the next question, please. All right, so next up for this question would be to please describe the emotions of the runner in this picture and tell us how this picture makes you feel. So I'm going to give you guys about half a minute or a minute to think about how you would approach this question. Okay, so I can see some people have talked about feeling accomplished, relieved, happy, proud. Yeah, grateful. Yep. Yeah, so one of the answers here is it makes you feel happy and proud, as well as appreciative of what this man has clearly come. I mean, given that this man has clearly come from a disadvantaged background, come this far and achieve something that he's very, and that makes him very proud of himself. Yeah. Yeah, so that's okay. So I can see a lot of you guys have been able to mention adjectives such as feeling proud, feeling grateful. It makes you feel inspired. So that's very, very good. And it's also good that you guys are describing the emotions of what you think the runner feels, and at the same time how this picture makes you feel. So again, beware of what the question is required, what the question is asking of you, and make sure to answer both parts of the question. And in this case would be how you feel and how you think the guy in the picture feels. So yes, so I understand that this is more of just you guys writing the chat box, just short of like short answers, and you guys have got all of it right. I mean, I think what you guys say are all valid, and I think it's all very, very good points. So the reason why I've put a question up as such, and for this question, what I would normally classify them is more of questions that deals with your human touch. So what I mean by that is sometimes, and no, I wouldn't say sometimes, I would say oftentimes medical schools actually want to see that you have the emotional intelligence to be a medical student, to be a doctor. A lot of times medical students in your UCAS, you would already say how well you do in your exams, how good your grades are. And a lot of medical students can offer that. So what they want to see in an interview especially is how you're able to take it a step further and to show them that you also have that human side of you, which is obviously very, very crucial as a medical student or a doctor. So these are the kind of questions which test that part of you, your emotional intelligence. So yes, you guys have mentioned all of that. And so one thing I would say that when approaching these kind of questions in interviews, it's important to say what are the points. So for example, you feel grateful, you think he feels victorious, he feels proud, so on and so forth. And those are good starting points, but do not forget to always elaborate further on why you think on why you have said that point. So for example, if you say that he feels grateful, why do you think he feels grateful? And this is where you can actually show them how you're able to take a step further. So for example, I'm just going to take grateful, for example. So obviously, I think one of your colleagues here mentioned that this guy has come from a disadvantaged background. He was either born with, say, less one leg, or say he might have gone through an accident at some point of his life that has caused him to use a prosthetic leg. So one thing that you can say is, again, on the theme of gratefulness, you can say that this guy is probably very grateful, not just other than the fact that he has just won the race, he's also probably very grateful that for all the support he has received. Obviously, for someone like him, it wouldn't have been easy for him to be where he is, to take part in a huge competition in front of a big crowd, and to have run and to have run a race with a prosthetic leg. So it's always good to explain further why you have brought up a point. And in terms of how the picture makes you feel, and this is where you can actually just, again, show them how you can think a step further. You can tell them from a doctor's perspective, obviously in the past few years, who would have thought that, not just past years, as the past few decades or centuries, who would have thought that prosthetic legs could be something? And that shows that you're able to think from a medical point of view about the advancements of medicine. So being able to provide patients with a prosthetic leg so that they are able to run a race again is something that's fantastic, something that obviously it's not just medicine, engineers would probably be involved in this as well, but it's something which the medical field offers, and it's something which we doctors can provide to patients, and it allows them to get back on the track, get back to live the life that they want to live, and get them to live their best life and to participate in races where they can actually win things. And obviously, from your perspective, as a medical student, or say as a doctor or as a prospective doctor, you obviously would feel very grateful as well, and you would feel the sense of satisfaction to be able to provide patients, or to provide this man the ability to say participate in this race, and for him to actually win something. So so what I'm trying to say in this what I'm trying to say here is that it's always good to tell them what you feel, tell them why you think you feel that way, and to also provide any evidence or anything that you can also use, any facts that you can use to back up whatever you have said. So if you are able to take it a step further and tell them when prosthetic legs were, say, for example, when they were actually offered to patients, if you can sort of like show off your knowledge in that way, go ahead and do it, because it shows that you have done your wider reading. But then again, I'm not saying that all medical schools will test on prosthetic legs. Again, this is just something which, if you know, then it's great, but if you don't, not worry about it. Again, all they want to see in the end of the day is the human touch in you. All right, and if you go to the next slide. So just a few key tips that I want to give you guys to approach MMIs, and these are tips which I've told all of my mentees. I've been, in the past years, I've mentored quite a number of students, and again, like I've said, they've gone to all of those universities that I've mentioned, and these are all the tips which I always tell students, which is very important for them to take note of when approaching MMIs. So number one, make it all about you, but obviously in a non-narcissistic way. So what I mean by that is, and I think it's something which Charmaine and Anna has also mentioned, the interviewers want to know who you are. So it's good to always tell them about things from what you think, tell them your opinions, tell them what you think about a particular topic. And so if you can see my second point there, I said to consider using phrases such as I think, and then you continue on with your sentence. So for example, if they were to ask you a question such as the curriculum in the curriculum offered in a medical school, they obviously know what's good about their curriculum, but they want to know why is their curriculum good for you. So it's always good to tell them, so your curriculum offers this and that, and then always move on to the next point where you tell them, say that, so for example, in Cardiff, if I were to go back to my days as an interviewee, I would say that, yeah, knowing that Cardiff offers case-based learning in their first and second year, then I would say stuff such as case-based learning in the first and second years would allow me to think of patients in terms of cases, and to also and how that would help in my learning is that it helps smoothen my transition between the preclinical years and the clinical years. So how I've actually put it there is that I've made it personal to me. I've given it a think. I've thought about how the teaching style at the university would help my learning. So that's what's important for you to convey. Do not just tell them, say, oh yeah, the course is great. The course offers case-based learning, and then it offers placements in different rotations. If you're just going to tell them about the course but not telling them how the course is good for you, you're not going to be any better than people who might not know about this tip. The second point is to have 2 to 3 well-reflected scenarios, and I think this is something which Anna has mentioned as well. And obviously one of it should be your work experience. So in cases like this, you would want to have a few scenarios. You do not need to have 6 to 10 different scenarios. You just need to have 2 to 3 very, very good ones where you're able to explain the scenario and talk about what you have learned from it and how the lessons you have learned can help translate into you being a better medical student or a better doctor. And this will be very useful, especially if you have these scenarios at your fingertips. It'll be very useful when approaching stations which test on your interpersonal skills, work experience, empathy, teamwork, and personal insights. So if you have these scenarios and just think about how they can be versatile, how they can be spoken about from different perspectives, that will be very, very useful to you as an interviewee. And yes, always go for depth over breadth. So instead of, when they ask you a question, you have 5-6 minutes to answer, it's always better to just go into detail about 1 to 2 scenarios than to talk about 5 or 6 different things and just name dropping things which don't really mean much to them. And of course, the next point is do not forget the human touch. I think I've explained that in the previous slide. And next slide, please. So one thing that's very important is to speak to seniors who have been through the process. And this is good for 2 reasons. Number one, seniors will be able to give you an idea of the course in a way that the university website will not be able to convey to you. And what I mean by that is seniors will be able to give you a bit more detail, which if you were to take note of all of that and if you were to deliver that in your interview, whoever the interview is, they would probably know that, okay, so this student has actually taken the initiative to speak to one of our students and they actually know about our course, they know what we offer, they have done their homework, and this guy or this girl is very interested to actually join us at our medical school. So it's always good if you're able to show that to your interviewer, to show that you actually have a good understanding of the course. And when I say about good understanding of the course, you do not have to go into detail about how it is from 1st year to 5th year or 6th year. You don't have to worry about that. I would say that it's good to just have an overview of how the course transitions. So you want to know things like, what is their teaching style? Is it a traditional teaching style? Is it PBL? Is it CBL? When do they switch over from the preclinical years to the clinical years? And you want to know about, and in detail, especially about how 1st year is going to be taught. So as you can see, my first point there, the first sub point, know what is expected of you, especially in the 1st year, because that's where you'll be starting off when you go into medical school. And again, also have a think about how their teaching styles will benefit your learning. And the second point as to why it's good to speak to seniors is because sometimes in interviews, you have different interview stations, and okay, I'm not exactly sure how they would do it virtually this year, but what I mean by that is sometimes in the past few years, some institutions, they have stations where they require you to do a bit of role play, and some schools have also require you to perform a skill such as urinalysis. Of course, it will be a bit more difficult for you to do that this year, but it's just something to know. If you're able to speak to a senior, then it's good to get an idea of what is expected of you and what could actually come up in the interview, because you don't want to not prepare for a role play and then end up having to face a role play, because that can be a very stressful thing to do. At the same time, you don't want to over prepare for a role playing station, but to only realize that it didn't come up in the interview at all, and you realize that all of that time you spent on role play could actually be used to prepare for something else. So it's always good to speak to seniors who have been through the process. Ideally, seniors who are not too senior, because you want the most updated information. So the next point would be for MMIs, especially at this stage, because I know a lot of my mentees, they used to ask me about whether do they have to revise their personal statement. I would say, based on my understanding, a lot of MMIs do not discuss your personal statement because they're interviewing about 9 to 10 students at one time. It's going to be difficult for them to read 10 personal statements consecutively. But then again, just check with your seniors, because they will be able to give you a better idea as to whether personal statements are used at the MMI interview. And lastly, be sure to practice regularly, but not to the extent where you sound rehearsed, because the last thing that you want to do is to sound like a robot or to sound monotonous at your interview, which is going to be a great turnoff for the interviewers. So that's the end of my slides, and I hope you guys found that useful. And again, if you guys need any help, feel free to reach out to me, or feel free to drop your questions in the chat. And I hope you guys find it useful from all of the talks that we've had today. Thank you very much.
Okay, so right now I'm just gonna put the link to the feedback form in the chat. And it'd be brilliant if all of you could just fill that in. Oops. And now we've got some time for the Q&As. So the first question. Okay, so Amelie has asked, how do you think COVID-19 might affect junior doctor contracts? Does anyone want to take the question?
Well, I guess a lot has been required to junior doctors, as well as student nurses, student midwives during COVID-19, just because the hospitals were so busy with patients and more. So maybe they would ask for better coverage during situations that are unpredictable, like pandemics or more. But as I said, we can't really know a lot about it. All we can do is keep on checking the BMA, watching the news, and things like that, in order for us to understand where all of this junior doctor business will head to.
Yeah, I think a lot of changes will actually just depend on what really happens later on. There's nothing that's fully determined now.
Yeah, and if I could say one thing about junior doctor contract, so it's good if you have an idea of how the junior doctor contract is like, or how, or just have a think of how it might change. But I wouldn't say that for a lot of these stations. So for example, these things would require you to have a bit of extra reading in terms of into the news and stuff. It's good if you have a bit of knowledge into it, but you do not have to stress out and like read newspapers every day, or like don't stress out too much about that, because that would at most only take up one station, which in a way you can actually prepare for a lot of the other stations, like use your time to prepare for other stations.
Okay, next question. Am I eligible to apply for the Mentee program if I'm an international student? Yes, you are. We accept all students from various backgrounds, and I can put in the link for the sign up Mentee sheet if you'd like to join our initiative. Okay, next question. In the sign up link, is the school email my own school email or teachers? I don't really understand that question.
I think they're asking, when they sign up as a mentee, do they provide their own email or their teacher's email?
Oh, please provide your own email, because we will then contact, depending what region you're in, there's a regional head for the university near you that will then contact you. Will the feedback form be sent to your emails? Yes, I will send it out again later for those who have missed it. During the interview, what is the maximum stations that you would be able to go through? Does anyone want to take that?
I honestly think I went through 8 stations, I'd like to say 8 or 9. However, numbers might vary due to COVID-19. Everything is online, and most likely you're gonna do it by going into a breakout room. But honestly, it passes very, very quickly, and you're not even gonna feel like you just spent like an hour and a half or 2 hours going through an interview, because the pressure will be a little bit on. But what I can tell you is that practice as much as you can, and you will be fine.
I don't think there's exactly a maximum, the number of stations that a school can have. I think, like what Anna said, it could be 8 to 10, somewhere around that number, but it shouldn't be obviously like 15 or 12. I think that's a bit too much. But yeah, like you will go on very quickly, and I would say that to have a very, very good rest before you interview, because as much as it feels like it's going to pass very fast, it can be very tiring as well. And you don't want to burn out halfway in your interview, because that's not ideal at all.
Okay, next question. Oh, this is for Charlotte. Okay, thanks for replying, Charlotte. I normally ensure I consider the ethics. However, some people have told me to use the actual terms, and I'm finding that difficult to do.
I think that just comes with experience of debating ethics. So if you ever did religious studies, I said in my slides, it's quite an advantage, is consider how you would structure an essay to hit those criteria and hit those marks. So some people do that by literally saying a word and then justifying it, but other people can show that they're actually considering those 4 terms just verbally without having to say them. So if that's the advice someone's given you, you can use that. But if that doesn't work for you, you don't have to. You can still hit all the criteria they're looking for without actually saying those 4 words.
Yeah. Okay, next question. The questions in the Mentee form ask about A-levels. Can I still sign up as an IB student? I would say, yeah.
Yeah, that's fine. Just put the subjects you've done. Many of us have done IB, so when we read your form, we will understand what subjects you're doing. Don't worry.
Yeah. Okay, and then next, hi, I've applied to your program, but I'm a grad student. Is that okay?
I mean, I think, yeah. I don't know.
Can you email us actually?
Yeah.
And we will get back to you about that. I'll just put the email into the question right now. What was your hardest question?
Oh,
I
mine
think
wasn't a question. Mine was what I had to do. They literally stared at me and they were like, rewire a 3-pin plug, and I was like, but apparently no one could do it, so I felt better after.
I think I had something very similar. It was like we had to play with something that looked like a laparoscopy thing and pick up some things and like some rings and make them drop onto like a stick or something. It was honestly very hard to do the skill, but when I was doing it, I thought, okay, this is so hard. I'm sure they're not gonna like take me based on if I'm able to use this device or not. So when they ask like, oh, why do you think this is important for a medical student, etc., I said that maybe if you would like to go into surgery, muscle memory is very important, or it's good for you to learn something similar and be able to give instructions. And it was absolutely fine. So don't worry about it if you find yourself in a similar situation.
Okay.
I've got a whole
like
list of questions from the chat as well, by the way.
Okay, yeah.
Yeah, let's go through them. We still have like 12 minutes.
We've got a lot of time. Seth, do you want to add anything?
Yeah, sorry, I cut off.
No, it's all right. No, I just want to say for hardest question, I wouldn't say it's a hard question, but sometimes you can have a bit of tricky questions where they show you a picture. So for example, let's say they show you a picture of the beach side, and then they just ask you questions like, what do you think of this picture? And then you're probably, I would say that when, basically in medical school interviews, sometimes when you're being thrown that kind of questions, what's good to do is to always have a think about why are they asking me this in a medical school interview? Sometimes like if you feel a bit thrown back, just take a step back and think, why are they asking me this in medical school interview? And I mean, how I approached it is more of, so for example, it's a picture by the beach. So I answered it from a medical perspective, like what kind of conditions do you expect to have for the population who lives by the beach. Then you can also say things like, oh, or in that picture, given there's quite a zoomed out picture, like from an aerial view, I don't see any GP clinics, I don't see any hospitals nearby, which obviously it might mean that the people around that area are not very much accessible to healthcare. Like, it's going to be a bit difficult for them if an emergency happens, or if if anything, or if they require any access. So, think of it from a medical perspective or a healthcare perspective. Always ask yourself, why are they asking me this in a medical school interview?
Yeah, I remember in my interview, I got a picture of a skin disease and they asked you to just describe it. And I was like, okay, how do I just because I was right, you're under time condition as well. So you need to just be calm and just think through, okay, how do I tackle this? Just remember it's quality over quantity all the time with descriptions and writing. Okay, will the feedback form be sent through email or is it available here? I've put the feedback form into the chat, but I will email all the registered attendees later again for the feedback forms. If there was any advice that you could give to yourself if you were in this position again, what would it be? I say for myself, I would tell myself just to be more calm. Because I know for me, when I get a bit panicky and nervous, I talk really fast, like really fast. And that's something I had to keep on telling myself through every single station. I was just thinking, okay, Charms, you need to be calm. You've learned everything. You've done your research. You know what you want to say. It's good. Don't worry about it.
Yeah, I'd say similar. The big thing with, I think, medical applications is sort of reminding yourself that you deserve to be there. Because I think I got my rejections from Cambridge and Edinburgh in the same week, and then the next week I had to go to Manchester and interview. So it was like you have to sit yourself down and sort of remind yourself, I have worked, I do deserve to be here. Those places just weren't right for me. And I think that's the advice I'd give myself. It's not the end of the world. You'll end up where you're supposed to.
I agree with you, Charlotte. And I think something else that I've told myself before my last interview at medical school, which then ended up being the interview for the university I currently study at, was that, sometimes things don't go as planned, but that's not the end of the world. If medicine is really what you want to do, you will find another way, even if your MMI doesn't go as well as you would have expected it to. So don't put too much pressure on yourself. It's a chance for you to show how good you are. The thing is, if they've invited you, they like you. So don't question yourself. Don't feel like you're an imposter there, like everyone else is better than you. You deserve to be there, and that's a chance you have to show them. But if it doesn't go as planned, there will be other ways for you guys to be successful and to show that you can be an amazing doctor.
And I would say that if I could go back in time, I would say that the one thing which I find most helpful to preparing for medical school interviews is to get someone, to get a mentor, or as in basically a senior who is really dedicated, someone who is actually really happy to help you with your interviews, because I think that makes a very big difference. And I'm sure some of the speakers here today would also agree that finding a senior can actually make a very big difference in the outcome of your interview. I mean, of course, on top of all other things such as doing your preparation and staying calm, getting a senior would be very, very helpful as well.
Yeah, just to add, so Sat was actually my mentor before I came to Cardiff, and he really helped with the interviews. So it's really helpful when you have someone who's just about maybe in the year above, and he's fresh head as to what the interview was like, and giving you a lot of information about the university, the course, the way the interview is structured. Because every university will have different ways of carrying out MMIs and different number of stations and what type of stations they have. Okay, Charlotte, do you want to go through the questions that you wrote down? What we haven't
Yeah, so there's a couple I think we will deal with individually. So there's one, they asked for specific advice for St. George's and Plymouth, and I don't think between us we actually went to any of those. So if you just email that question to us later, we can send it out to our regional heads in those two universities, and they can maybe get back to you with some advice. The next one was, is the last station 1-to-1? I've answered this question a few times, and all your MMIs will be you on your own, and usually you'll get a maximum of 2 interviewers. If it's a role play, one of them will be the actor, and one of them's basically just watching what you do and how you answer and taking notes. Charms, I think this is a good one for you. How do you think MMIs will be different on Zoom this year?
I think in terms of having it as a virtual interview, it's going to be quite weird because you're not seeing the interviewer in person. So I think if they were to run it on Zoom, what they do, because for international students, they usually have interviews back home where they are from anyway. So what they do is that they could put you into a breakout room and then they will shift you to a next breakout room. So you stay there and they will just invite you to the next breakout room, or they may give you like different links to join, and I'm not sure how the timing is going to work in between. I think a lot of universities are still trying to figure out how it's going to be run, because I emailed Cardiff applications team and they haven't got back to me yet. So I think the universities are still having some difficulty with it.
A good question for
sorry,
everybody. Oh, carry on.
No, sorry, I just wanted to say one thing very quickly about how the interviews are going to be run. I know that it can be a bit scary as an interviewee, not being able to visualize how things would be, but I'm sure all the universities they would actually come up with like a proper structured way to run it. And if there's any faults within it, like you don't have to worry so much about it. Like if it's a bit laggy or if it's things like that, like the interviewers are humans themselves, they will understand that these things do happen sometimes.
Yes, as Charlotte said, please email us at events@In2MedSchool if you have any Mentee specific question or any uni specific question. So if you want to know how interviews are run in a specific place, we can just ask our regional head for that university to answer, as well as if you would like to have a mentor, but you belong to a specific category like a gap year student or a grad student, please email us at In2MedSchool@gmail.com or DM us on Instagram, and we will treat cases individually. I read something else that I wanted to answer about the Mentee scheme. If you do not fill the required criteria on the Mentee form, can you still try and sign up? Unfortunately, you cannot, because you will be excluded from the mentoring scheme. This was created to help disadvantaged students to get the advice they need to get into medical school. So unfortunately, if you do not belong to any of those categories listed there, yes, you will not be paired with a mentor, but you can still come to all of these free events that we do, or check out all of the free resources that we have on our website. Follow us on Instagram. We post questions there daily, cool cases to read about, and more. So there's still lots and lots of resources available to you.
Okay, we've got 2 questions in the Q&A. One's asking, are there any points to take note of as an international applicant during interviews? I'd say as an international applicant, in my experience, you may have more experiences and opportunities that you've gone through that you can use because you're from a different country. Some questions that are asked, I'm pretty sure they can be, there are a few questions that are difficult for international applicant because depending on like where you're from, I think. Seth, do you know if...
Okay, sorry. So the question is, are there any points to take note of as an international
applicant during interviews? Yeah.
I mean, I would say one thing to take note of is that probably there wouldn't be much different from what a local applicant would be. I mean, probably. I mean, so I would say that as an international student, probably I'm not sure how many international applicants apply, but I would say that in each medical school, the number of international students that they take in is obviously going to be, it's only 10, it's capped at 10% in each medical school, 10% or less. So it will be competitive. I'm not saying that that if you apply as a local applicant is any less competitive. I think either way, they all have their own sense of competitiveness. But as an international applicant, I would say the preparation is just about the same. Yeah, just do as much as you can, and don't be afraid to speak your mind and talk about your experiences, even if you think that it may not be directly relatable to them. As long as you're able to justify yourself and to explain what you are trying to say, I think it should be fine. Yeah.
I think also, like, because I am an international student as well, when I did interviews and I talked about my work experience was based on my home country and then in the country where I was living at that point, and none of them were the UK. So don't worry if you haven't experienced how a hospital works in the UK, etc. As long as you've done your background reading and you were able to experience what it's like to be to work in a hospital, you know, the different health professions that are there, the qualities like teamwork, communication skills, and more, you will be fine. They will not say like, oh my God, you didn't go to a placement in Guy's hospital, I'm never going to take you for medical school. It's completely fine. Don't overthink it, guys. Many international students and European students are there, and you can do it as well.
Okay, we have another question. If I've experienced visiting a hospital in another country as a patient rather than as work experience, can I still talk about it?
I think you can.
I'd say you can, as long as you are able to reflect off it. So as from a patient point of view, you can say, from what I've learned from the care that was given to me by the healthcare workers in the hospital, it showed me the importance of teamwork and the multidisciplinary teams in the hospital and how doctors are doing their best to work in the patient's best interest. So together in that, you already put in the qualities of of becoming a good doctor, as well as including ethics of beneficence into your answer. And so with that, just in a few minutes like that, you've really included quite a few good points into your answer. Okay, Charlotte, do you wanna?
I'm sure like you can answer it, you know, in a question that asks you about communication skills, about what makes a doctor come across as empathic to a patient or as caring to a patient. I don't see why you wouldn't bring in your personal experience. I think that would actually, you know, show that you've been on both sides. Therefore, you understand what the side of the patients, you know, might need or might feel more comfortable with. But at the same time, if you've undergone something like that, don't feel like you have to share anything that you're not comfortable with sharing. Yeah.
Question-wise, there are a few that I can literally just whiz through. So, is there one station of each type in the MMI, or can it be multiple stations of one type? I answered this a few times in the Q&A. Basically, the framework we gave, those are the generic types that all universities will cover, but some of them will overlap them. So some will do a role play that does prioritization, some will do a role play that covers ethics. They will usually just overlap all of them until they get all the criteria they want. That follows on to the question, will there be lots of role plays and only one interview? Depends on the uni, but usually it's sort of an even split in my experience and my friend's experience, but you never know. Will we have questions asked similar to BMAT section 3, so ethical debates? Yes, that's the medical ethics station. You're going to have to, this is also a question, do you form an opinion clearly or do you keep balanced? Both. You need to be able to have an opinion, but you can't come across as irrational or polarized or discriminatory. You need to show that you're a level-headed person who's going to treat all patients equally, but also that you can form your own opinion and get that across in a professional way. But if anyone wants to add to that, it's really easy to work through.
Just try to be open-minded, because they could give you any case scenario and they want to see how you would tackle it and how you view it from both perspectives.
Yeah, and I would say that for those kind of scenarios where, so for example, let's say we're talking about abortion, for example, what I would do is, or how I would approach it is, I would talk about the pros and cons, and then what I wouldn't take a stand. I would say that, I'm just going to say that, I wouldn't say whether I am for or against it. I would just talk about it on both sides, and then I would say that, then I would just end my answer by saying, obviously, this is what I think of given the scenario that you have given me, as in I'll tell the interviewer that, and I'll say that obviously it's a lot of these things it's not so much of a one-person decision. If you're able to show them that it's more of like an MDT decision, like you say, not a decision on my own, but it's something which everyone has to discuss about it, and especially you have to discuss it with the patient. Then only then can I arrive at an answer. If you're able to show your interviewer that, it shows that you understand that decisions like this are not something that is just within your hands, but it's something that requires discussion with a lot of other people as well.
Next question is a good one for everybody. What was your answer to the question, why medicine? Anyone want to take that one first?
So I would say that why medicine is not so, like I could tell you what I answer, but I would say in the end of the day, I think what matters more is why you want to do medicine. And I think someone asked me that question just now as well. How do you answer that question? Because I can understand that sometimes at an interview, I just ask you, so, okay, you're now here at the interview, why do you want to do medicine? And you can sometimes come off as like point blank to you, and you're just like, how do I answer them? I would say that that's why prior to interview, it's always good to have a few scenarios in your head. And these are the times that you can use those scenarios. Always start off with why you want it. So normally I use this framework called AREL. I'll just normally tell people AREL stands for A, the argument. So what are you trying to tell them? Like, why do you actually want to do medicine? So some people can be, I like helping people. And then your R, your reasoning. So why do you like to help people? Has there been any event in your life or anything that has happened that makes you want to help people? And I know a lot of times students or in mentees, they become very scared, like they don't know if their answers are actually good enough. But I would say normally the most personal answers are the ones which stand out the most, because those are the ones which truly reflect who you are. So for example, let's say the reason why you actually want to help someone, okay, let's just say the real reason you want to help someone is because, say, during your work experience, you encountered a patient who had to undergo a surgery, and and it was just that one moment where you saw the patient crying and crying and crying, and what you did was you got her a tissue, you got her a cup of water and a biscuit, and then you sat down with her, you held her hand, you made her feel so much better, and then she also felt much better. She felt more reassured for the surgery, and she actually, like, just a small scenario like that, but it makes a big difference if you're actually able to convey it and you're able to deliver it to the interviewers, and to actually tell them, say, oh yeah, so actually that moment, at that very moment, when I made a difference to that woman's visit to the hospital for surgery, that's the moment I knew that I wanted to do medicine. This is what I want to do for the rest of my life. It may sound like a very silly story to you. I don't know, it could be something which you feel is not important to tell because it's just as simple as giving someone tissue paper. But if that actually means something to you, let the interviewers know, because they want to know why you want to do medicine. Do not be afraid to share with them your personal story. So yeah.
Yeah, I'd agree with that. It was very much for me just being truthful, because whenever I was writing my personal statement, it was like, don't be cliche, but tell them you've thought about this for a few years. So just be honest. If you've wanted to do it since GCSE, when you first encountered your first medical, I don't know, curriculum, I think that's what I mean, in biology, then say that, but then remind them that you've also built on that. And for me, it was when I had volunteer experiences, and there were really difficult things that happened on the wards for me, and those were what affirmed that this was what I wanted to do, because as difficult as it was, I wanted to go back and do it again the next week. So yeah, that honesty is the best thing you can offer them, because that's what sets you apart from everybody else, is your personal experience.
I think also, don't be afraid to say that medicine wasn't all you've always wanted to do, because that shows that you're open-minded and you've actually thought about this and you've reflected about this. If you say like, oh, before I was out of the womb of my mom, I knew I wanted to study at your medical school, that's somewhat unrealistic. But if you say, I really enjoy looking at society and talking about politics, and I like art history, and I think that medicine kind of brings together all of these, because I can take care of people, and that to me is political, and I can somewhat shape the society around me. And at the same time, I can look at amazing anatomy drawings. So medicine brings all of my passions together. Or you can say, I really liked engineering, but then I did work experience in that and medicine, and thought that medicine was what was better suited for me, because I am a very good team player, or because I like taking care of people, or I like teaching. So always, I think it's good to bring it back to your skills and your qualities. At the same time, don't oversell yourself and be like, I'm gonna be the best, because you're probably not gonna be. But that's fine, because it's okay.
That was brutal.
No, it's okay, it's realistic. I think the better the sooner you know, the better it is. But
Yeah, definitely.
that doesn't mean that you won't be an amazing doctor or an amazing medical student.
Okay, do we still have a lot more questions, or?
Only two. So there's one that's sort of simple to answer. How do I show empathy in an interview without just saying I'm an empathetic person? I think it's an easy trap to fall into when you're doing so much prep for interviews, to think you have to take on this new form, but literally just think, how do I show empathy in day-to-day life? It's just the way I behave, the way I treat people, the way I respond to situations. You don't just sort of talk monotonously when someone's saying, oh, my house was robbed and I'm really traumatized. You're like, oh, okay, let me get a doctor to help you. That's not how you behave. Just behave like yourself and you'll show empathy. That's why you're applying to medicine.
Yeah, I think with that, just like reflect on how you felt as well, because your emotions will play a very big role in how you show empathy, and the way, like what Shad said, the way you react, everything that you do with your response would lead to empathy, well, depending on what the situation is, of course. Yeah.
And I think this goes back to the one time, I mean, in my slide, when I say to have 2 to 3 scenarios in my head which are versatile and which can back up these kind of scenarios. Like you want to be able to provide them with a good example as well. Say, oh yeah, so I'm an empathetic person, I've done this, I've done that. But there was this one time where I did what, then you explain your whole story, which actually reflects how you're an empathetic person. And again, when you deliver your story, do not forget the human touch, because that can make a difference.
And I think this human touch that Seth's talking about is not something to show in one station only. It's something that you can show throughout by just being yourself. So if you're doing a communication station, I think a very good technique that they often teach in communication workshops in medical school is kind of like repeating what a patient is telling you, or acknowledging how they're feeling. So if Charlotte, as Charlotte said, if somebody comes to you and they're like, oh, they robbed me, you're not gonna be like, oh, wow, cool. You're gonna be, I'm sorry, I understand that this is a bit distressful for you, and I will try to do my best to help you out, and we can try to find a solution. So sometimes repeating like, oh, like acknowledging how the patient is feeling, or the person is feeling, can be helpful. I think I had a station where I had to kind of coach somebody, one of my friends at medical school would fail their exams and they were gonna resit. So they came to the interviewees saying how sad they were, that they felt like they weren't good enough. And of course, if a friend of mine comes to me and they say that they're not good enough and they're gonna drop out, naturally I would show some emotion. I would say like, don't say that, like we can just work together and devise a better plan, something that can work better for you. So don't get too stressed about having to show empathy, because I think if you've come to, if you've gone into this place, if your teachers have said, yeah, you should apply for medicine, if you've always wanted to do it, I'm sure you are a good enough human that will know how to, behave empathetically towards somebody in a difficult situation.
We've got sort of a follow-up question from that in the Q&A, which is, how do you do that without being too sympathetic or pitiful? I think that's something they're trying to gauge from you in those interviews. So the best example I ever saw of it on work experience was, I was in a fertility clinic and the doctor had to break the news to a couple that had been trying for 9 years that they weren't going to be able to conceive no matter the method they gave them. And she was fantastic. She showed emotion. She actually She was teary. You could hear it in her voice that she was upset, but she did not stop giving them the information, affirming to them that they would come back and discuss this again, that any upset they had was valid. And she managed to show this complete humanity in it, but also doing what you have to do as a doctor, which is tell them the truth in a way they understand, and tell them that they don't have to take it all in now, that you're going to support them through it. So there's no such thing as too pitiful, because that branches more on patronizing, as if you're not treating them as you would in a real consulting case. But the biggest thing with empathy is this is something you're coached through during medical school. I have consultation skills classes every single week, and we're still working on how do you go through everything as a doctor, but also show empathy? How do you not make them feel pushed down a track? How do you not cross any boundaries? They're just looking that you have the foundations of that, and that's what they're looking for right now. Don't panic about things like that. Next question was, if we are asked if we have any questions, what kind of questions should we ask? For me, in one of my interview circuits, it was really intimidating. Yeah, I think this is the last question. They would say anything that you say after the activity is finished will be recorded and listened to later. So if you don't have a valid question, don't ask one, because it can look very like you're waffling, you're fluffy, and you're just trying to fill a gap. If there's no real substance to your question, don't ask it. You'll know if there's one to be asked. But if anyone else has any follow-up on that, go right ahead.
I agree, and I think like maybe online this is gonna be even easier, because you won't feel like you are in a room with somebody and you need to make conversation. You know, if your station is done, mute yourself and just wait for the time. I think it would be better than saying anything that maybe would be considered inappropriate, or that the interviewer would be like, oh, you haven't done your research. Like if you ask, so is this university case-based, or preclinical and clinical years, like, or science years, and then a transition? Like, don't ask anything that you could have easily looked up online, I think, because that would show that you haven't done your research. Yeah,
definitely. Don't expose yourself, basically.
Yeah, definitely.
I think that's it. I have no more questions, and there's no more in the Q&A.
I think that's it. And we went through so many questions, which I was glad to do, because that means that you guys were really responsive, and we were able to help some way, I hope. Yeah. Please follow us on social media, etc., because there will be many more events coming up, like a panel interview and a very, very exciting event where we're going to bring people that have sat on the other end of interviews, telling us what they look for in candidates that they interview for medical school. So that looks like an interesting event, I think, and I would have loved to have that when I was applying for medical school. Many cool things coming. So yes, follow us on social media, even if you don't qualify for the mentoring scheme, because something valuable can come from all the other resources that we have. And thank you once again, Seth and Charlotte, for joining Charmaine and I during this event. You were all great, and I think we saw that by the level of engagement that the attendees showed. I think I'll send once again the feedback form in the chat.
Yeah, I'll email all of the attendees who registered to the registration link. I'll send the feedback forms, and I'll send the Mentee sign up link if they want it as well.
Please know that it takes a few days to go through all of the certificates, because we send you the recording as well, which sometimes needs to be polished. However, if you haven't heard back from us in, let's say, a week or 10 days, it might be because you've provided the wrong email address, or because your school address blocks emails from external providers, like In2MedSchool is. So maybe drop us an email in a week or 10 days. If it's bounced back or anything, we will be able to then email you again and send you the certificate. Thank you so much, guys. I think that's it for me. Unless anyone else wants to say anything else?
No.
Thank you in bold.
Well, you guys are very kind.
Yeah, thanks everybody.
All right. Thank you so much, and hopefully
Right,
see you.
thank you, guys.
One Q&A. Oh, thank you. Perfect. Okay. Thank you so much, guys. See you
Thank
next
you.
time.
Right.
Bye-bye.
Bye.
Bye.